Hello, welcome to this short interpretation of what has happened over the past couple of months when many countries around the world implanted so-called lockdowns and brought the economy to a standstill and left social life in ruins. And now we have to pay an immense price for these policies, and I try to show that the lockdown was not necessary, and that in fact it was the result of an overreaction and can justly be called a socio-psychic hysteria that has grasped a large part of the population of the globe, not just in Europe, but also in the United States. Now here we have the number of daily confirmed COVID-19 deaths, and this is on a worldwide scale. I chose the world as a whole because individual specialities of certain countries, certain regions, thus are more likely to disappear, and we see the proper curve, so to speak. Now, let me point out a few things. First, let us note that from beginning of the year, exactly from January 22 onwards until mid-March, the curve was basically flat. That means that any observer would not have reason to suspect the occurrence of a pandemic. And this is typically the case. We look backward on things and we already know how they have developed. But things looked at the present and into the future is quite a different thing. In other words, no one really knew that an exponential rise would occur, which then happened towards the end of March. And now another point must be mentioned. When this exponential stage is reached, the curve rises very rapidly, and the huge number of cases here happens in a couple of few weeks or even days. And the faster it gets up, it never can be completely vertical. In the physical world, this is not possible. We reach some kind of peak, and from there we see the decline, which is typically erratic, but when we look at these oscillations, we see a clear trend downwards, so that we can say the peak for the world was in the middle of April. Now, how do we perceive these exponential occurrences, this exponential phenomenon, as they are typical for epidemics, but also in the economic world happen quite often? This is social psychology that has happened. And here, in terms of cases, this could be infection, this could be cases in the sense that people show symptoms, or it could even be the death rate. They are just different levels of the same curve, yes. And let's say this should be the death rate, the number of deaths, and per period, per day or per week and so on. So we have this curve as before for the worldwide scale, which can be traced back a long time into the past, where it was always invisible. Then we have this exponential rise, and it goes to a peak, and it slowly levels off. Now, how do we react to that? That's the point. As a society, as decision makers. First, in this first period, when the curve is almost flat, we naturally ignore what is happening. There is no other way. Yeah, we have no capacity to foresee the future. Yeah, all we have our senses and what we observe. Yes, and even the past we do not see. Yeah, so we have to reconstruct the past with data, but not in direct observation, and we have to project the future. Now, as a model, it all looks quite easy, but in reality, this is very difficult. And of course, when the first news came in that there should be a certain rise and what to do, we necessarily tend to ignore what is happening and to expose some negligence. Why? Because it is rational. If we would react to every small indication, let's say with every pain in the stomach, with every headache, we would run to the clinic, that would be outright crazy. Or with every dip of the stock market, we would expect the next mega crash. We would tend to overreact. But when things go on, and we have had ignorance and negligence, and we now observe, and the media jumps in and takes it up as a item, yeah, and exaggerates and creates beside the real world a media reality. Yeah, the population, inclusive of the decision maker, tend to enter into a state of panic. And when this goes on for some time, so we have the media hype, which is very important. We have the population that gets infected by the media hype. And then the politicians will join in, because anyone who would say, okay, let's wait, this thing goes by, would lose the respect of the people. The people want action. Yeah, in their hysterical mood, they want any kind of action. Now, the lockdown, and I can quote many countries here by date, yeah, in almost all countries at different times, yeah, the lockdowns were implanted in the face of panic and hysteria, when the real course of events was already past the peak, when the real infections and deaths were on the decline. But when the media showed accumulated numbers, it seemed so as if the pandemic would go on. Yes, it was a totally wrong picture that was shown. And people ended basically in a kind of frenzy, with a combination of the population itself, of the politicians responsible for the lockdown, that now had their stake in the lockdown, yeah, and the hype of the media, which was just amazing, still in some part. Now, after the peak happens when the discrepancy between the perception and the reality gets wider and wider, and just gets too wide. Yeah, after a while, one must notice we live in a dream world, maybe in a horror dream world. Yes, and this leads to the awakening. And after a while, when we see the danger is basically over, yeah, it leads to some kind of amazement. When we as society as a whole, or a large part of it, look back in amazement, and after a while they will look back in anger. And society is gripped by a rage and looks for a scapegoat. We must be very careful here, because in many countries we are already entering this stage from awakening to amazement and into rage and anger and looking for scapegoats. When things go on, here may happen very bad things, particularly when the real effect of the folly can be seen and felt in terms of unemployment, for example, in terms of lost businesses, in terms of poverty, yes, and realizing that with the lockdown, no life at all was saved because the lockdown came too late to have any considerable effect on flattening the curve. I could show these with specific data and give these in the appendix where I quote some literature and some text I've written about that. Well, let's hope we get back to normalcy as soon as possible. Here are the texts that I've mentioned. A series of articles that I published beginning in March, continued in April, and the last one is from May 15th, where you can find a detailed analysis of what has happened. Thank you very much.